I'm thrilled to be joined here with Dr. Smith, Chief Medical Officer for Aon. We have partnered with Aon before you and I needed these glasses, as we were discussing in the back. I'm really excited to share a conversation about what we see, a little you see, I see, we see, a little bit to learn what's happening out there in the group health market. Really important as we enter into this mid-year, and we're starting to see some changes emerging for next year. So let's jump right in. So tell me a little bit about, from your vantage point as Chief Medical Officer, where you have hundreds and hundreds of conversations, and so do we, about the emerging trends, what we're hearing from our clients, what are their needs. I'm going to give you a hot tip. There's this new thing called GLP.
I think that's on the agenda tomorrow.
Yeah. I just wanted to let you make sure you knew about it if you haven't been talking about it. But talk to me about what you're seeing changing in healthcare and benefits in general this year.
I would say we're seeing significant expansion in virtual care, probably most noticeable in specialty services. And I'm excited to see the enhanced integration of data from digital programs as well as wearables. That drives connected care. We don't need another point solutions that could drive fragmentation, so that connected care is critical. We're also seeing better use of data, and I think virtual care is uniquely positioned for more real-time data aggregation, and more importantly, real-time provider to member support to drive better outcomes. Yeah, sure. So unique position. Now, we are excited to see what's coming next. How will you evolve to continue to meet the needs of our population, which is changing? To give one example, I'm working with 3 large employers who came to us and said, could you identify and curate a network of lifestyle management physicians in functional health? 2 reasons. You can't find them in a provider directory with your health plans. And 2, they have a young workforce that asks leadership, we want a more natural lifestyle support for wellness and health promotion versus just going on medications for high blood pressure or cholesterol. They want the lifestyle support. Great opportunity for virtual care to kind of evolve with the changing population.
Yeah, absolutely. And we've seen some of that as well. Let's talk about chronic conditions, because it's topic du jour.
It is.
Well, tell me about what you think is sort of uniquely changing around chronic disease management. And we're starting to see a shift, sort of a sea change around how people are approaching it, what their expectations are of chronic. So I'm curious to see how you're coaching your plan sponsors around their healthcare strategies in the chronic disease management space.
Yeah, first I think it's important to, when you're developing any kind of healthcare strategy, to address that full continuum of needs, not just jump to a solution to treatment. It really is, what are you doing around prevention, risk reduction, and then treatment or management. And also support the entire person, not just take a condition-focused approach, so whole person. That's critical, so that's the start. Virtual care is going to be critical for management of chronic conditions. I hate to use the term perfect storm, but that's what we're facing. Majority of chronic conditions are increasing in prevalence every year. Diabetes, cardiometabolic, even cancer. And we're seeing more of the population have multiple conditions, 2 or more diseases, many with 4 or 5 or more, higher risk. Right. At the same time, more access challenges. We're forecasted to have a 40,000 shortage of primary care by 2030, and 20,000 shortage of psychiatrists. So more need, but less access. Right. Chronic care is going to be a vital part of virtual care. Again, starting with prevention and risk reduction. I have to commend Teladoc for the acquisition and integration of Catapult. It's a great way of driving up more screening, which is going to drive up higher identification of people with disease, hopefully earlier in the course, as well as people with health risk. Then pull all the assets together that virtual care brings to better support your at-risk as well as your chronically ill population, and address risk and needs that escape the traditional healthcare system, like SDOH assessments and more focused member support.
Right. And we're starting to see that in our work with Catapult and even just identifying rising risk.
Yeah.
And our clients are excited to see, have a window into that they otherwise wouldn't. So let's talk about what you're seeing in broad emerging trends. What are you expecting to see? And how do you see virtual positioned to help solve that next year?
Well, and when you look at, we're seeing 8% to 10% trends, and that's probably going to continue the next couple of years. So from the lens of most clients that I'm working with, it's how do you help better manage healthcare costs? Look at what's driving healthcare costs. As we mentioned, more chronics and they're sicker, less preventive services, unfortunately, so people are just diagnosed with conditions later. Unnecessary, inappropriate care, partially by fragmentation of the system, part of it by lower quality physicians. Look at what virtual care can do. Right. Better management of chronic conditions, and back upstream, better management of people with health risks to prevent disease. Use of high quality, more cost efficient physicians and a more cost effective place of service, less fragmentation, more connected care. And a real opportunity is to drive higher use of second opinions, which is a real challenge. Right. So those are all the opportunities. I think, the employers will look at what can you do to control costs. Now, they also need to solve for next-gen problems. And virtual care, again, is going to be critical. We've already talked about primary care shortages, so virtual primary care is critical. But specialty is our next big challenge. Right. We've had over 500 facilities stop doing obstetrics in the last 10 years, and over 380 facilities stop giving chemotherapy. So we have cancer deserts and OB deserts around this country, rural and semi-rural areas. How do these members get the support they need? How do you support that population? I think virtual care has a really role to plug in to solve these specialty deserts that we're seeing created. Yeah,
for sure. And I think we'll talk a little bit more about that tomorrow too. I think the administration is doing some really interesting things around positioning virtual or positioning new technologies to help support. So thank you so much. I really enjoy spending time with you as always. So
my pleasure.
Appreciate you being here.
Thank you.
Thanks.
Thanks, everyone.